Okay, I have an order to give our patient John Doe some morphine 2.5 every 4 hours IV push for pain. I've done my drug problem, it's 0.6 milliliters. I've checked my order against my MAR, my patient's allergy, he has known allergies, and my patient's name, John Doe, and the medication, morphine 2.5 milligrams IV push every 4 hours for pain. I did my drug problem at 0.6 milliliters. I'm going to check the safe dose in the book against the book, and it's 2 to 10 milligrams, so we're safe with that. And you can give it every 3 to 4 hours as necessary. It cannot, you can give it undiluted, but since it's a small amount, we're going to dilute with normal saline and give 5 milliliters. Give 1 milliliter every minute for 5 minutes. And it is compatible with what we have hanging, the D5W. The rate to watch, what we're going to be really watching for our patient is to watch and make sure his pain is decreased and respiratory distress, because this is an opioid and it will cause respiratory depression. We're going to monitor our patient 30 minutes after we give our medicine. So now I'm going to go to the med room and prepare my medicine for my patient. I'm going to wash my hands. I'm going to check my medication against my MAR. It's morphine. And the expiration date, it is not expired, so we're good. And then what we're going to dilute it with is normal saline. So I'm going to prepare this medicine. I'm going to draw up my morphine first. Okay, I have 0.6 of morphine. And then I'm going to draw up the rest to dilute our medicine. To 5. Recap. So we have 5 in there total. Before I leave the med room, I'm going to label my syringe. And to label it with my patient's name, the drug, the amount, and the expiration. So now I'm going to go to my patient's room, and I'm going to check my patient by 2 identifiers. His patient name and date of birth against his armband and against my MAR and against my medicine. I'm going to check and make sure the IV site is still good. And it is. Our IV site is, we have no redness or irritation or drainage or anything, so it is good. So our patient, he has no allergies, and now we're going to administer our medicine. We're going to administer it to the closest port of the to the patient. We're going to give our medicine to our patient because he has pain. He says his pain was a 7. So we're going to give him this medicine because his pain is a 7. And I'm going to wash my hands. Before I give this, I'm going to ask him his name and date of birth, and he tells me his name is John Doe. His birthday is 6/15/2000, and I identify it with his armband and his MAR. So I identify it against that and his MAR. So now we're going to give this medicine. Wash my hands. I need to clean my port. Okay. Are you ready, Mr. John Doe? He's ready, so we're fixing to give him his medicine. Okay. We're going to clamp it. We're going to give 1 milliliter. Okay, going to release. A minute has passed, so we're going to give another. Another has passed. So we're going to give another. And we're going to release. Give another. Going to release. I mean, pinch. Give another. Give another. And release. And we use the port that was closest to the patient. We're going to undo this. We're going to discard of all of our supplies. We're going to come back and check on our patient in 30 minutes to see if his pain level has decreased. And then I'm going to document on my MAR the dose, the route, the rate, the drug, and I'm going to initial my name and the patient's response. And that is all.